Imagine this is your child. Imagine him playing with his friends. Imagine him having hundreds of debilitating seizures a day, every day. What if medication failed to offer relief? What if the repeated seizure activity so overwhelmed your child that physical and mental development came to a grinding halt? Imagine.
My little daughter's gonna be so excited. Is she out here? Yeah.
On the 23rd of October in 2002, William Sullivan Adams brightened the world of Jason and Tracy Adams.
Here we are, folks. Baby Sully.
And Macy had a new little brother. Sully, as they chose to call him, went home from the hospital in seemingly perfect health. But less than 3 weeks later, Sully was taken back to the hospital when his parents noticed what appeared to be a seizure. After endless hours of testing and waiting, and more testing and more waiting, the doctors returned with a diagnosis as rare as it was difficult to pronounce: hemimegalencephaly.
The brain's development is a very, very complex kind of thing. When some of them start to develop abnormally, then you get miswiring when it happens on one side of the brain, and when the cells are enlarged or overgrow, you get hemimegalencephaly.
At 18 days old, Sully was diagnosed with this extremely rare brain disorder that causes intractable seizures. Jason and Tracy were then informed that the seizures could initially be managed through various medications, but his only hope for leading a seizure-free life was through the removal of one side of his brain in a procedure called a hemispherectomy.
And you have to take out that whole side of the brain if he's having uncontrollable seizures.
Imagine. Needless to say, Jason and Tracy were shocked, confused, and at a loss for what to do. After extensive research, consultations with the leading medical professionals, and much deliberation, they made their decision. They determined the best path to pursue was to delay surgery, treat Sully's seizures with available medications, and follow his progress. And what amazing progress it has been. Over the next few years, Sully continued to develop, grow, and be a kid. During this period, a combination of various medications worked to hold off the seizures for a few months at a time, when they would have to be increased as seizure activity increased. The remarkable progress he was making in his physical, occupational, and speech therapies allowed Sully more time to continue to develop and defy the odds. It's 2008. Sully is coming up on his 6th birthday, and he's shown extraordinary progress over his first 5 years. But the seizures have increased, and even a combination of medications can't stop the seizures from breaking through 20, sometimes 30 times a day. His doctors have recommended surgery.
You want to get rid of the seizures, you want to get rid of the side effects of the medication, and let the child go on his way.
When I see a patient who's a candidate for a hemispherectomy for the first time, I still have pretty shocking news to tell them. Now, they've heard the word hemispherectomy, but when you really sit down and start describing it to them, I think it really begins to hit them at that point.
They turn over their child to me or to Carson and say, go take out half the brain. I don't know how you make that decision. It requires enormous faith in God. It requires enormous desperation. It requires seeing that there is no light at the end of the tunnel except this kind of radical surgery.
What we're talking about is doing a frontal lobe lobectomy, parietal lobectomy, occipital lobectomy, and a temporal lobectomy. Either physically removing all of those lobes of the brain or physically disconnecting all of those lobes of the brain so that the electrical input from them can no longer get to the rest of the nervous system.
With Sully's best interests at heart, Jason and Tracy have made the decision to go ahead with the surgery.
What we're really looking at here is quality of life. A life that is peppered with multiple intractable seizures, all kinds of medications, and restrictions is by no means a quality life.
No more medications, no more nerve-wracking trips to the hospital, no more seizures. Imagine